Hi, my name is Sean Darwin L. Silino and this is my science performance task about ailments affecting the central nervous system and their treatments. First is the Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is a type of dementia that affects a person's thinking, behavior, and ability to perform everyday tasks. Alzheimer's disease is associated with a buildup of certain proteins and chemicals in the brain, which leads to dementia symptoms that worsen over time. The brain contains millions of brain cells that organize how the brain stores memories, learns habits, and shapes our personality. Alzheimer's disease affects these cells and the chemicals, disturbing memory, impairing thinking, and causing behavior changes over time. What are the symptoms of Alzheimer's disease? Early on Alzheimer's disease may be hard to notice. The first signs are usually memory loss and difficulty finding the right words for everyday things. Symptoms will progress differently between people depending on what areas of the brain are affected. Alzheimer's disease tends to target the outer part of the brain first, which is associated with learning and short-term memory. As the disease progresses deeper into the brain, other functions are affected and symptoms get worse. How is Alzheimer's disease treated? Although there is no cure, certain treatments may improve symptoms for a time. An early diagnosis allows your doctor to work out if there is another cause of your symptoms that may be treatable. A group of medicines called cholinergic drugs may temporarily improve cognitive symptoms of mild to moderate Alzheimer's disease. A person with Alzheimer's disease should try to maintain normal social contact with friends and family, exercise regularly, and engage in activities that stimulate the brain. Next is Bell's palsy. What is Bell's palsy? Bell's palsy is a sudden weakness or paralysis in one side of the face. It is caused by inflammation or damage to the facial nerve. A viral infection is thought to be the main cause of Bell's palsy. The infection puts pressure on the nerve that controls the facial muscles. It can be mild or it can be severe. A few people don't recover fully and are left with some weakness or paralysis of the muscles in their face. What are the symptoms of Bell's palsy? The main symptom is weakness or paralysis of one side of the face. It is usually at its worst within 2 to 3 days after its first appearance. Bell's palsy can also cause a drooping eyelid or difficulty closing one eye, difficulty smiling, and making facial expressions. Drooping of one side of the mouth, changes in the amount of tears or saliva. How is Bell's palsy treated? In most cases, Bell's palsy symptoms improve without treatment. Most people start to get better in 2 weeks and are fully recovered in 3 to 6 months. A doctor may prescribe oral steroids or an antibacterial medicine in the first few days of its onset, as this can improve the chance of a full recovery. They may also prescribe lubricating eye drops, an eye ointment, or face massage. However, it can take several weeks or months for the muscles in your face to regain their normal strength. Other treatment may help in your recovery, such as corticosteroid drugs, antibacterial medication, and over-the-counter pain medication, which can help relieve mild pain. Next is cerebral palsy. What is cerebral palsy? It is a condition in which the ability to control muscles is reduced due to nervous system damage before, during, or after birth. This nervous system damage affects body movement and posture. Usually, a confirmed diagnosis of cerebral palsy is made by the time a child is 2 years old. It occurs when there is damage to the developing brain in the area that controls muscles tone. In some cases, the motor cortex fails to develop normally in the fetus. What is the cause of cerebral palsy? The cause remains unknown for most babies with cerebral palsy. There is no single cause of cerebral palsy. The damage to the brain does not worsen with age, but it's permanent. How is cerebral palsy treated? There's no cure for cerebral palsy, but resources and therapies can help kids grow and develop to their greatest potential. A child can have therapy for movement and other areas that need help, such as learning, speech, hearing, and social and emotional development. Medicine helps kids who have a lot of muscle pain and stiffness. Leg braces help with walking. Kids can improve their bone health and by eating diets high in calcium, vitamin D, and phosphorus. Next is epilepsy. What is epilepsy? Epilepsy is a long-term brain condition where a person has repeated seizures. Having just one seizure is not considered to be epilepsy. About half the people who have one seizure never have another seizure. Other conditions such as fever, diabetes, heart conditions, and alcohol withdrawal can also cause seizures. Epilepsy is not one single condition. Rather, it is a range of different conditions that can cause seizures. What are the symptoms of epilepsy? The symptom of epilepsy is seizures. These are episodes of disrupted electrical activity in the brain and can vary greatly depending on the part of the brain involved. The cause of epilepsy is unknown in half of cases. Genetics play an important role. How is epilepsy treated? Most people with epilepsy are able to control their seizures with anti-epileptic medicines and by avoiding triggers. The type of therapy you need depends on factors such as how old you are and what types of seizures you are having. Several new treatments are being explored. These include surgery on the area of the brain causing the seizures and vagus nerve stimulation, where nerves in the neck are stimulated by a device placed under the skin. A strict medically supervised diet used in some children with epilepsy called a ketogenic diet, and medical cannabis, which has been shown in some studies to help people control seizures. And also Parkinson's disease. What is a Parkinson's disease? Parkinson's disease is a disorder of the nervous system. It results from damage to the nerve cells in a region of the brain that produces dopamine, a chemical that is vital for the smooth control of muscles and movement. Parkinson's disease mainly affects people aged over 65, but it can come on earlier. Doctors don't yet know the cause of the disorder, and it's thought to be inherited in only a small proportion of cases. Exposure to certain toxins in the environment is also thought to play a small role. What is the treatment for Parkinson's disease? There is no cure for Parkinson's disease. However, symptoms can be treated with a combination of medicines to increase or substitute for dopamine, a healthy diet with regular exercise, modifications to the physical environment at home and work, and brain surgery. Your doctors will tailor your treatment based on your individual circumstances.